Another type of antigen we see on red blood cells is called Rh factor. And the Rh factor is another antigen that a person can react to, and we use the symbols positive, negative. So if you know that your blood type, for example, is A positive, that means you have A antigens on your red blood cell as well as the Rh factor. If you are O negative, that means you have no antigens on your red blood cells, and you do not have Rh factor on your red blood cells. And actually, OH negative is the cleanest red blood cell to donate and receive because there's nothing on those red blood cells for us to respond to in terms of having a reaction. So what happens then if we have a mother who is Rh negative, and when she conceives and forms a child in her womb, that child ends up with, say, the father is Rh positive, and the child inherits that on the red blood cells and has Rh present on the red blood cells. What can happen is near birth, that child can be exposed, or the mother can be exposed to the blood from the child, and that causes her to form antibodies to that Rh factor. So when that crosses the placenta, again, which can happen closer to birth, that sensitizes her. Then if she goes on to have another child and she's sensitized to Rh, she has antibodies to Rh, that can cause problems in the newborn and cause clumping and death. It's called erythroblastosis fetalis, when the mother's antibodies, which can cross the placenta, attack the baby's red blood cells and cause an agglutination reaction. So what we do for mothers that are Rh negative is we give them a shot of what's called RhoGAM, and RhoGAM will actually act as Rh and cause the mother to form antibodies against the RhoGAM and not against the baby's red blood cells, thereby protecting that baby. So very, very important that we know the blood types of mothers that are coming in for prenatal checks, so we can make sure that anybody who is Rh negative is getting the RhoGAM shot. So again, if you are an O negative blood type, we would really encourage you to donate your blood, because your blood does not have any antigens on it which would react with the recipient's antibodies. And that's very, very important for keeping our patients safe and making sure we have a good blood supply. But now, if you go and look at, say, an accident scene where we have a patient on the side of the road that's bleeding profusely, we certainly don't have time to get their blood type. Ambulances will carry O negative blood type just to be sure that we have a clean red blood cell that we can donate to patients and make sure that we don't have to worry about blood typing in the meantime. But if they would need more blood and we have time once they come to the hospital, then we would definitely try to match the blood to their blood type. So regardless of your blood type, all blood types are needed, and it's important that everybody donate if they're able.